Manteada sifting with a rebozo is something that's been done for centuries with indigenous cultures, especially the ones I'm familiar with in Latin America, like the Mayans. But we've also seen them done in Southeast Asia, like Laos. One of the important things to understand about rebozo work is this is a sacred tool for a lot of people. In fact, a lot of their family history and genealogy they'll weave into the fabric, so you can see the story of an entire family in a rebozo. These aren't just used for birth work in these cultures. Babies are swaddled in them, children are wrapped in them, women will carry them through their lifetimes, they'll even be buried in them. And so when we're doing this kind of work, it's important to honor those traditions. But I also want to emphasize that I can't think of a better tool to use for moms who have fascial restrictions in their abdomens. Mothers who have had C-sections and are attempting a vaginal birth after a C-section, or if they've got a lot of restriction in there because they've been athletes, or if their abdomen has a separation in it and we need to help give her relief. This is a phenomenal tool and we use it all the time in our practice. The first thing to understand about a rebozo is that you need to set it up properly. Now, you don't have to necessarily have one of these at home. You can use any long piece of fabric, like you could use a sheet, or if you have a table runner, you could use that, or a really long scarf. Really anything that's going to wrap around from the top from mom's rib cage down to the bottom of her belly. Our rebozos are about 9 feet long, so I can use them when I'm standing. And so what I do is I make sure that I fold in the rails a couple inches so that when her belly and her hips are coming in contact with these creases, it doesn't rub. I don't know if you've ever had your ankle taped and someone did a kind of a crummy tape job and you end up with a blister there. It's really uncomfortable when we get friction when something's shifting side to side. So the rails are really a good comfort measure for that mom. To begin the sifting, you'll have the mom in her hands and knees position, and there's a couple important tips to this. Instead of having her hands directly underneath her shoulders and her knees directly underneath her hips, you'll have her walk her hands forward just a little bit, so she's almost making the letter A with her body. She'll move her knees just a little bit back, and that really gives you enough room to be able to wrap her abdomen. You'll take the rebozo and bring it up and around her hip, going under the ribs and around the tummy. And then you'll gather up the fabric in your hands. Now, a good tip for partners with this is you want to be able to have a piece of fabric that's going to be broad enough and long enough so you can stand up. As you're adjusting the rebozo, again, try to smooth out as many of those wrinkles as you possibly can, because that's going to help her stay more comfortable. Once you have all the wrinkles out, your hand position is to allow the fabric to come up through your hand so your thumbs are pointing up towards the ceiling. You're going to take a little bit of a soft kneed stance, but try to stay as upright as you can, and then you're just going to gently lift her tummy. When you do the sifting, you're going to be making a really subtle motion up and down with your hands. Remember, you're just sifting flour with this activity. You're not trying to make a milkshake. You do the rebozo sifting for somewhere between 2 to 5 minutes. And as you do this, it's a great idea to ask the mom to take a nice big breath into her tummy, let her belly drop all the way to the floor, and then exhale to relax her abdomen. It's going to feel really, really, really good for her. For moms who have had belly births or have had a C-section, one of the things that you can do is bring your hands forward a little bit to feel a little bit of the fascial pulling at the very bottom part of her tummy. Have her focus her breath into there. It's really important that we get that fascia released. When you're finished with the sifting, simply let her relax her tummy, let the rebozo come down, and then go ahead and help her up.